Hello and welcome to a new week of Tuesday Tips. And if you watched my video last week, I talked about the annual enrollment period, or AEP, and I just wanted to cover what is a Medicare Advantage plan. So you hear a lot of advertising and you hear a lot of probably news articles or mailers that you get about Medicare Advantage plans. I just want to touch on a couple of things about them. And so Medicare Advantage plans are called Part C, and so your original Medicare is Part A, which is your hospital insurance, and your Part B is your doctor and your health insurance. So the Part C actually combines the A and the B together, and some of them have a Part D plan, which is your prescription coverage built into them. So they're called Medicare Advantage prescription drug coverage. So MAPD is how those are described. And so the two main types of Medicare Advantage plans are going to be your HMO plans or your PPO plans. And so these plans are actually sponsored by private insurance companies, and the HMO plans have networks that you have to stay in for your coverage. And so you have to make sure that your doctors that you go to for your services are in their network and they take the plan. And then you also have to have a referral if you want to go see a specialist. So if you need to have any kind of specialty procedures or any kind of specialty diagnosis, or say an orthopedic doctor or a heart doctor, thyroid doctor, GI doctor, any doctors that are specialty, you would have to have a referral from your primary care doctor to go see them in those plans. And so the other thing to remember about the HMOs is if you go out of their network, then you're going to pretty much pay 100% of the bill. So when you're in the networks, you pay a lower cost. Sometimes you pay a zero cost for some services. Some services have co-pays that you have to pay. Some services are a percentage base that you pay. Now, if you do a PPO plan, then you do have in and out of network benefits. So you do have the option of going out of network without a referral. And you still have maybe a higher cost, but that means that the plan does take it, but it just is going to charge you a little bit more for your services. So those are kind of the main Medicare Advantage type plans that are offered. There's also some that are chronic plans. So if you have any kind of chronic conditions, health conditions, you may qualify for those type of plans. There's also plans called dual special needs plans. So that's if you have Medicaid and Medicare together, and those plans are very specific to that type of situation. And so they have a lower cost for some of the services, and you don't have to you still have a network that you usually have to stay in because the doctor has to take the plan. But it does give you some lower costs out of pocket when you go have services done. Now, the Medicare Advantage plans have a max out of pocket that vary between the plans. It just depends on what the plan offers, and it also depends on each year. So that's really good to think about when you're looking at a Medicare Advantage plan, because once you between what you pay and what the hospital pays, once you reach that max out of pocket, and it can be anywhere from $2,500 up to $7,800, depending on the plan options, you won't pay anything else out of pocket. So usually it's a an amount that, like I said, between what you pay and what your provider pays and what the plan pays. So those are some things to think about when you're looking at Medicare Advantage plans. And I'm going to attach a link to this video below about a comparison between original Medicare and Medicare Advantage plans. It kind of gives you an idea of the comparison between the two. There's a lot more details that go into these, but I just wanted to briefly kind of give you an idea of what you're looking at when you're looking at a Medicare Advantage plan. And if you have any additional questions, I'd be happy to answer those. You can reach me at the number below of this video or my email. And I look forward to talking to you next week.